Hello, my friends. I'm Linda Parker, and in this space, many people know me as Dr. Linda, a guide who helps men and women en la madurez understand their health with clarity, calm, and common sense. Today, we're going to talk about something that very few professionals explain with honesty: the medical tests that people over 50 are told they must do, but that, in realidad, many of them almost never need when they are healthy, have no symptoms, and have no special risk factors. This isn't a message against medicine or against prevention. It's a message in favor of intelligent prevention, where you understand what each test can and cannot do for you, and you decide with information, not with fear. For years we were told that the more tests we do, the better. That a long list of exams every year is a sign of responsibility, and that saying yes to everything the system offers is the safest path. But the science of longevity and senior well-being is showing something very different. After a certain age, too many tests can create anxiety, false alarms, unnecessary procedures, and even complications that damage health instead of protecting it. More medicine is not always more health, especially after 50. So I want to start with a clear agreement between you and me. In this video, when I say tests you never need after 50, I'm referring to this specific situation. You feel well, you don't have worrisome symptoms, you don't have a special risk such as a strong family history, and someone is ordering these tests as a routine just in case, year after year. If you have symptoms, if you are in treatment, or if your own health professional has a clear reason, the conversation is completely different. This content is educational. It doesn't replace personalized medical evaluation, and it doesn't cancel what your trusted professional recommends for your particular case. That said, there is something you have every right to question. Tests that are ordered by inertia, simply because you crossed the birthday of 50 or because it's in the protocol, without anyone explaining the risk-benefit balance in a mature body. A body over 50 is not a fragile machine that needs constant scanning. It is a wise system that, with good habits, can maintain vitality, circulation, and clarity for many years, without becoming a prisoner of hospital corridors. Before going test by test, I want to give you a simple habit that will accompany you for the rest of your life. Before saying yes to any exam, ask 3 questions. First, what decision will this test help us make? Second, what are the possible harms or complications? Third, if the result is slightly abnormal, but I feel fine, what would we do with that information? If the person ordering the test cannot answer these 3 questions in a clear and calm way, it is very possible that you are in front of a test that you don't really need. Let's start with one of the big protagonists of unnecessary testing after 50. The full-body scan, the famous complete CT or MRI to see everything. It sounds modern and powerful. Many people tell me, Linda, if the machine sees everything, it will find cancer early and I'll be calmer. The reality is almost the opposite. When you scan the entire body of a person who feels fine, the machine almost always finds little spots, small nodules, shadows that, in the immense majority of cases, are benign and would never have caused problems. But once they appear in a report, they start a cascade. More scans, biopsies, procedures, weeks of waiting, fear, and sometimes complications from surgeries that, in retrospect, were not necessary. In addition, these just-in-case scans expose you to radiation when it's a CT, which over the years accumulates. And there is something even more subtle. When you tell your mind that you need a full-body scan every year to be safe, you send the message that your body is a constant threat, that disease is always lurking, and that you can never relax. That belief alone increases stress, alters sleep, and indirectly affects circulation, blood pressure, and immunity. If you feel well and have no specific reason, A full body scan is almost never a test you need after 50. A much more intelligent use of technology is to perform very targeted imaging only when there is a concrete suspicion based on symptoms or well-founded risk. The second test that is widely overused after 50 is the routine chest X-ray as part of the annual checkup in a person who does not smoke, does not cough, does not have chest pain, and breathes well. For years, large institutions themselves have recognized that taking chest X-rays in asymptomatic adults as a routine screening does not improve survival, does not detect lung diseases earlier in a useful way, and does increase the number of false alarms. A small shadow on the film can mean nothing, but it opens the door to more imaging, sometimes to invasive procedures, and always to anxiety. If you have respiratory symptoms, history of heavy smoking, or exposure to toxins, imaging has its place. But the classic, "I'm fine, it's just for the checkup." Chest X-ray is one of those tests that, for many mature adults, adds more worry than benefit. The third test that many healthy people over 50 do not need as routine is the resting electrocardiogram, or the exercise stress test, when there are no symptoms and no significant cardiovascular risk. The heart is an organ that deserves respect. Measuring blood pressure, checking cholesterol and sugar, maintaining a healthy weight and good circulation with daily movement are essential habits. But ordering an EKG or a treadmill test for every person who turns 50 simply because of the number on the birthday cake is not necessarily intelligent medicine. In low-risk people with no chest pain, no shortness of breath with mild effort, no known heart disease, and no strong family history, these tests rarely change management. On the contrary, they can show minor variations that are normal with age and that are later interpreted as disease, opening the door to more tests and to labels that accompany the person unnecessarily for years. What protects the heart of a person in the second half of life is not an annual stress test without indication. It is the daily walk that raises the heart rate without exhausting you, the decision not to smoke, the choice of real food that respects your arteries, the good management of stress and sleep. These are the tests that really predict how your heart will be in 10 years, how far you can walk without stopping, how easily you climb stairs, how quickly you recover your breath after a moderate effort. If you have symptoms, if you are diabetic, hypertensive, or have history, that is a different conversation, and specific cardiac tests can be life-saving. But as a routine ritual in a low-risk person, the EKG and the stress test are often tests you do not need every year after 50. The fourth group of tests that are frequently unnecessary in healthy adults after 50 are the famous complete hormone panels ordered out of curiosity rather than necessity. I mean blood tests that measure a long list of hormones, testosterone, estrogen, cortisol, thyroid hormones, and others, every year, even when there is no clear symptom that suggests a hormonal problem. It is true that hormones change with age. This is natural. But numbers on a lab report are only part of the story, and in many cases, they reflect normal adaptation to maturity, not disease. When you order large hormone panels in someone who feels well, you often find values that are slightly outside the reference range, but are completely harmless. The danger is to start treatments that the body does not need, such as unnecessary hormone replacements or supplements in high doses, which can have long-term effects. Instead of chasing perfect lab numbers, after 50 it is much more useful to listen to functional signals of your body. How is your energy throughout the day? How is your sleep? How is your mood? How is your ability to concentrate? How is your appetite? How is your body composition? When these aspects show changes, then yes, it may make sense to look in detail at certain hormones with a specific purpose and a clear plan of action. But ordering broad hormone batteries every year for everyone, without symptoms and without a strategy, is one of those practices that you can confidently question. The fifth set of tests that healthy people over 50 almost never need as a routine are the so-called tumor marker panels, or cancer blood tests, offered as a way to detect everything early. These markers are substances in the blood that can increase in certain cancers. They have a limited and very specific use when a cancer is already known, and the healthcare team needs to monitor how it responds to treatment or if it reappears. But using them as general screening in someone who feels perfectly fine, has no alarming symptoms, and has no strong family history is a strategy that usually creates more confusion than clarity. Tumor markers can be slightly elevated for benign reasons. They can be normal even when there is cancer. They are not precise radars to search your whole body in a simple blood sample. What happens when a tumor marker comes back a little high in a healthy person? More tests, more imaging, sometimes biopsies, and very often, in the end, no cancer is found. The person spends months living with the idea that something very serious might be hidden in their body, with all the psychological and physical impact that fear brings. In mature adults, protecting well-being also means protecting mental calm. Accepting every cancer blood panel that is offered without understanding its limitations is not necessarily the best way to take care of yourself after 50. The sixth test that many people repeat more often than necessary after 50 is colonoscopy in those who had a completely normal exam and have no new symptoms. Colonoscopy is a powerful tool and has saved many lives when used at the right time and at the right interval. If at 50 you have a colonoscopy and it is totally normal, most modern guidelines extend the interval to 10 years in average-risk people. However, there are adults who are told to repeat the test every 3 or 5 years without a new reason, only because you have already turned X age, or because the system is programmed that way. Every colonoscopy carries small but real risks: perforation of the intestine, bleeding, problems with anesthesia, and of course the discomfort of the preparation and the procedure. Repeating it too frequently in low-risk people multiplies those risks without adding protection. What is very different is the person who had polyps, who has family history of colon cancer, or who has new symptoms such as bleeding, change in bowel habits, unexplained weight loss, or pain. In those cases, the conversation is different, and closer surveillance can be essential. But if your colonoscopy was spotless, you feel well, and someone suggests repeating it long before the recommended interval without giving you a solid reason, you have every right to ask, what do we expect to find now that we wouldn't find in a few more years? And what are the risks of doing it again so soon? The seventh test that many mature adults do not need, with the frequency that is sometimes suggested, is the bone density scan repeated year after year, when there has been no change in treatment, no major fracture, and no new risk factor. Measuring bone density at least once after 50 or 60 can be very useful, especially in women after menopause and in men with certain conditions. It helps to know if there is osteopenia or osteoporosis and to decide on nutrition, exercise, and in some cases, medication. But once the baseline is known and a plan is in place, repeating the scan every 12 months in a stable person rarely changes decisions. Bone tissue changes slowly. In many cases, intervals of several years are more than enough. What happens when you test too often? You can see tiny variations that are within normal measurement error and interpret them as worsening, leading to treatment changes that are not really necessary, or to the addition of medications with side effects. In senior well-being, the goal is not to chase perfect numbers at any price, but to keep bones strong enough to support the life you want to live. Walking, climbing stairs, dancing, playing with grandchildren, maintaining independence. That has much more to do with daily movement, strength exercises, adequate protein and sunlight than with a yearly scan. At this point, You may be asking yourself, if there are tests that I almost never need as routine after 50, what should I focus on to protect my health and longevity? The answer is simpler than it seems. Instead of using machines and laboratories to search for problems that you don't have, use your energy to build daily habits that keep your body in balance and your mind in peace. Walk every day at a pace that allows you to talk, but not sing. Eat food that comes from the earth and not from the factory as often as possible. Protect your sleep as a sacred appointment. Train your muscles with gentle resistance exercises. Strong muscles support strong bones and better circulation. Keep your social life alive. Isolation at 60 can be more dangerous than high cholesterol. There is also an invisible test that I like to recommend to everyone over 50. The test of listening to your own body. Once a week, sit in a quiet place and ask yourself, from head to toe, how you really feel. How is your breathing? How does your chest feel when you climb stairs? How is your digestion? How is your urination? How is your intimate health? Your confidence with your partner? Your sense of vitality? When you cultivate this internal observation, you often detect early changes that are much more meaningful than a number slightly above or below a reference range. Let me share with you a simple story that I see repeated in many versions. A 55-year-old man, active, with good habits and normal checkups, begins to feel that aging is a threat. Everywhere he hears about sudden heart attacks, hidden cancers, surprise diagnoses. Out of fear, he starts requesting every test available: annual full-body scans, repeated stress tests, hormone panels, tumor markers, the complete collection. For several years, nothing serious appears, but each report brings some indeterminate finding that leads to more exams. His life, which was full of work, family, and hobbies, slowly becomes dominated by waiting rooms, results, and we should repeat it in 6 months. His sleep worsens, his worries increase, his physical activity decreases, his intimacy weakens. Paradoxically, the obsession with early detection makes him feel older and more fragile than he really is. One day he decides to do something different. Instead of asking, "What test is missing?" he asks, "What habit is missing?" He reviews his routines. He realizes that he spends many hours sitting, that he eats well but very fast, that he accumulates stress and does not decompress, that he has postponed many things he enjoys. Together with his healthcare team, he keeps the tests that genuinely match his risk profile and lets go of the rest. He chooses to invest that time and that money in daily walks, in a simple strength routine, in improving his sleep environment, in preparing better meals at home, in reconnecting with his partner. 6 months later, he does not have fewer gray hairs, but he has more light in his eyes, better circulation, more stable mood, and a renewed sense of control over his life. That is the true heart of this message. The most important test after 50 is not a machine that looks at you from outside. It is the way you live each day from inside. Medical tests are tools, not oracles. Some are essential and life-saving when there is a clear reason. Others, when used indiscriminately, create more problems than they solve. Knowing which is part of mature well-being. If I had to summarize everything we have talked about in one sentence, it would be this: after 50, intelligent health is not about doing more tests, but about choosing better which tests you really need and putting most of your energy into habits that strengthen your vitality. You are not a walking diagnosis waiting to be discovered. You are a complete person with the power to decide how you want to age. And I want to leave you with a message of hope. It is never too late to change the way you relate to medicine. Even if you have spent years saying yes to every exam out of fear, you can begin today to ask better questions, to seek professionals who are willing to explain, to respect your intuitions, to balance prevention with quality of life. Your 50s, 60s, 70s, and beyond do not have to be a marathon of hospital visits. They can be a stage of clarity, autonomy, and deep well-being if you place yourself at the center of your health decisions. If this message resonated with you, take a moment after this video to reflect. Which tests are you doing just by inertia, and which really have a clear purpose in your life plan? Which habits have you postponed waiting for the perfect moment? You can also share this content with someone you love who is living overwhelmed by tests and fears. And if you want to keep receiving guidance on well-being, longevity, and vitality in the Madurez, I invite you to stay close, to subscribe, and to continue this journey with me. I'm Linda Parker, and it has been an honor to accompany you today. Take a deep breath, trust your body a little more, ask your questions without fear, and remember, your health is not just in the hands of the system. It is, above all, in the small decisions you make every day.